morning, my lord.
Good morning, Miss van der Westhuysen. Now, we've got 3 witnesses this morning, I see.
We do, my lord. We have a panel of representatives of 3 Scottish universities. We have Dr. David Duncan, who's the Deputy Vice-Chancellor and Chief Operating Officer and University Secretary of the University of Glasgow. We have Professor Penny Macbeth, who's Director and Chief Executive Officer of the Glasgow School of Art. And then we have Professor Carl Lydecker, who is Senior Vice Principal of the University of Aberdeen.
Thank you. Very good. Good morning to you all.
Morning.
Miss van der Westhuysen no doubt has some questions for you, so I'll ask her to fire ahead.
Thank you very much, my lord. I think before we kick off with the panel session, if I could ask you each in turn, I've obviously introduced you, but if you could please give your full name and your role now and during the pandemic, please. And if we could start perhaps with Dr. Duncan and work our way down.
Okay, I am David Duncan. I am Chief Operating Officer and University Secretary at the University of Glasgow, and that was the position I held through the pandemic.
Thank you.
I'm Professor Penny Macbeth, and I'm Director and Chief Executive Officer of Glasgow School of Art.
Thank you. And Professor Macbeth, when did you take up that role?
Sorry, I joined Glasgow School of Art in May 2020.
Thank you.
Hello, and I'm Carl Lydecker. I'm Senior Vice Principal at the University of Aberdeen, and I was in that role throughout the pandemic, joining in March 2019.
Thank you. And then each of your universities have provided a response to a Rule 8 request. My lord, I'll just read out the numbers so you have those. For the University of Glasgow, the reference number is SCI UGL XXX and 000001. The reference for the response from the Glasgow School of Art is SCI GSA XXX 000125. And then the response from the University of Aberdeen is in 9 parts, or certainly the parts that we've lodged for the purposes of these hearings are 9 parts, and they all start with SCI UAB XXX, and then the first one ends in 02, the second one in 03, the third one in 04, the fourth one in 10, fifth one in 11, sixth one in 19, seventh one in 20, the eighth one in 40, and the ninth one in 41. So it's one response, but it's broken up. If I could ask you now each in turn, please, just to give an overview of your university in terms of size and number and location of campuses, a broad indication of the demographics of your student populations, and just a broad outline of the types of courses you offer. And again, perhaps we could start with Dr. Duncan and work our way down the line. Thank you.
Okay, well, thank you very much. University of Glasgow has been there since 1451. It has turnover of nearly £1 billion a year. We've got just over 40,000 students with a balance of undergraduates and postgraduates, just slightly more undergraduates than postgraduates. Most of the students, maybe 90% of them, are at the Gilmore Hill campus, the west end of Glasgow, and the vet school and some research activities are out at Garscube. It's about 3 miles west of Gilmore Hill, and then we have a small campus with about 1% of our students in Dumfries, and then a number of students being taught collaboratively with other institutions in Singapore and on 3 campuses in the People's Republic of China. But the vast majority of activity is at Gilmore Hill.
Thank you. Professor Macbeth?
The Glasgow School of Art was founded in 1845. It's a small specialist institution with world-class status, and at the time of the pandemic it had 2,365 students. It's now risen to about 2,765. We have around 35% international students, and the rest are 20% rest of UK, and the rest are Scottish domiciled students. We have subjects that range from fine art practice through to digital innovation and design and architecture, so a really broad range of suites. We're intensive and are very workshop and studio intensive. We are situated in 2 campuses, one in Glasgow and then a tiny campus in the Highlands of Scotland in Forres, which is a really very small percentage of our students. That's us.
Thank you very much. Dr. Nag, I might have missed it, but did you give an indication of what percentage are foreign students at Glasgow?
I didn't. I think it's probably around about 30% currently, and I should have said, of course, we teach pretty much the broad range of disciplines across the academic endeavour.
Thank you, and you specifically mentioned veterinary medicine as well. Thank you. Professor Lydekker.
So the University of Aberdeen, founded in 1495, a little bit later. We have about just over 20,000 students. About 15,000 of those are in Aberdeen. We have a very large number online, one of the larger online providers in Scotland. We have about 5,000 students online and about 1,000 students overseas, either in Qatar or in China, in partnership with other universities. About a quarter of, or more than a quarter of our students are from overseas. I would say around 70% are undergraduate. The rest are taught postgraduate, so that's one-year master's programs, but we also have a significant cohort of PhD students, so research students. In terms of subject mix, we have, in terms of campuses, we have two main teaching campuses. We have the Old Aberdeen campus, and then we have the Forester Hill campus, which is joint with NHS Grampian, where we have our medicine, dentistry, health sciences, nutrition, biomedical sciences. We also have a student residence which is separate from the two campuses at Hill Head, and I think that in terms of subject mix, we would have the broad mix of degrees that you might expect from the health sciences, medicine, through natural sciences and computing sciences, through then social sciences, business, and humanities as well. But we don't have an art school. So few of those kinds of creative subjects.
Thank you very much. The intention today is really to hear about some of the key issues and impacts that were experienced by your students, staff, and the universities themselves under a number of broad themes. So time permitting, I propose that we discuss issues and impacts relating to, firstly, initial closure of universities, secondly, remote learning, remote and online learning, and the issues related to the move to that and the delivery of that. Thirdly, subject-specific impacts. Fourthly, specifically impacts on research and laboratory-based work. Fifthly, assessments, attainments and classifications and new admissions and issues in relation to that. Next, mental health, well-being and social impacts. Then issues specifically around the reopening of university campuses and return to face-to-face learning, and then the repeated opening and closures, and issues particularly in relation to guidance as well, if there were any particular issues you experienced with that. And then impacts on universities and staff. And then also I'd like to give you the opportunity to make suggestions for what the Scottish Government, in relation to potential lessons learned, what the Scottish Government could reasonably do to mitigate ongoing impacts of the strategic response, or could do differently to improve matters in future in the event of another pandemic. The inquiry is also particularly interested in disproportionate impacts on particular cohorts of students. We've obviously mentioned international students specifically, but obviously there may be other cohorts of students that were particularly impacted at your institutions. I haven't included a standalone theme for that, but that is something that's relevant to a number of the themes we'll be discussing. So if you're able to just remember, if you do have any particular concerns for particular cohorts of students, to raise that under the relevant subject, but if there is time and if necessary, we can always have a discussion of that at the end as well. So if we could perhaps turn first to issues in relation to the closure of universities, including, for example, the decisions to close, and obviously university campuses couldn't close completely, so I say close in inverted commas. Any prior consultation with and or relevant guidance received from the Scottish Government, and any issues with that. Immediate practical challenges that were faced by universities and university heads. Immediate impacts on students. We'll obviously go on to discuss specific impacts in relation to subjects and mental health, etc., but any immediate impacts that were experienced by students. Any disproportionate impacts on particular cohorts of students, and any other relevant key issues. So perhaps, again, if we could start with Dr. Duncan, followed by Professor Leidecker, and then because Professor Macbeth, you obviously started a little bit later into the process, pick up with you at the end, just what you know about having had discussions with your colleagues. So Dr. Duncan, we'll kick off with you.
Okay, well, thank you. It's fair to say, well, it was a bit of a shock, really, when we realised we were going to have to severely curtail activities on the campuses. But as you rightly point out, you can't close a big university. There are too many activities going on. Particularly, we had 3,500 students living in residences. They couldn't be sent home after the onset of the pandemic. There were a few research activities, bits of equipment, including animal research that had to be looked after and continued. Quite early on, I think, from government, there was a commitment to continue COVID-related research, so we had to facilitate that, particularly through our Centre for Viral Research, for example, and then just maintenance of equipment and buildings. So we still had quite a lot of people coming in to campus from very early on. The first challenge was really was a communications challenge, was to give advice to staff and students about how things would operate and what people should do. And it's probably fair to say in the early days, there wasn't a lot of information coming out of government or from public health authorities, either at the UK level or in Scotland, to tell us what to do. We were keeping in very close contact with other higher education institutions, making sure that our communications were consonant with theirs, and trying to give clear advice to staff and students about what to do. A lot of people were very worried, as you probably remember, at the time, about health issues. People were worried they were going to catch COVID and die, and so that first care was to do with people's health and advising them on how best to look after it. And I think, in retrospect, I think that the transition from full-on activities on campuses to something much more curtailed was done remarkably quickly and with little fuss. People followed the rules, they obeyed the rules, they had a thirst for information and communications, which we probably didn't satisfy totally adequately in the early days, but people were very receptive to the advice they were given and responsive. And then I guess we'll come on to talk about the educational aspects of that in a minute. But
yeah, absolutely. And just, you said people were very responsive. Are you referring to students, staff, or both?
Both.
Both,
I would say, yeah.
Okay. Professor Leidecker.
Yeah, so we suspended on face-to-face teaching on Friday the 13th of March 2020, and we accelerated our plans for all staff, or for home working for those staff able to work from home, on Monday the 16th of March. We were definitely taking our own decisions at that point, and we were fortunate because we were able to draw on the expertise in our medical school in public health. We were able to see some of the data that was emerging internationally about where infection rates were across the world, and we could see, Italy minus 10 days, and we could then see what was like to happen, and it was very clear to us very early on what was going to happen. So I think we reacted very early and moved very quickly. That allowed us to adapt quickly, but we had to make some really quite bold decisions. So we simply said to staff, take everything you need. You can take desks, you can take computers, and so on. But we moved very quickly. It was fair to say that our digital infrastructure was not in the shape that we were thinking. I remember we decided to turn on Teams on that weekend, so we didn't even have things that we now expect. So it's worth remembering that. So we moved very quickly to put things in place. We had a very, very good group that coordinated throughout the pandemic and brought everybody into the tent, that allowed us to mobilise people very, very quickly. And I think that stood us in good stead in terms of that rapid response. But as my colleague has said, we were unable to close, and we had to develop all kinds of guidance around who could come onto campus, under what circumstances, and so forth. And that worked very effectively.
And you say you had to develop guidance. What sort of guidance were you receiving from the Scottish Government at that stage?
I think that came about a week to 10 days later, when we started to get, but guidance developed more and more over the period, so we started to get full written guidance published on the Scottish Government website that would set out how we should operate in what circumstances. But very early on we were, obviously the universities were talking to each other as well, but we were having to make quite bold decisions at pace to the best of our abilities, really.
And just to what extent, because you obviously mentioned, Dr. Duncan mentioned that you can't close because you have laboratories, you have students on campus, etc. To what extent was that understood by the Scottish Government at the time, certainly in the initial stages?
I don't think it was. I think there was mention of we close the universities, and I think the sector had to indicate that that was simply not a realistic understanding of what universities comprise of in relation to, for example, we were supporting the health response, for example, from both our staff and some of our students who were studying in the medical areas. We obviously had the residences that we couldn't close, as has already been mentioned. Getting the IT facilities in place was very important in order to address the digital support, first of all, for our staff, but also the digital poverty of students. We had to have people on campus to keep the servers going, to package up the boxes and email and send out the packages of our IT equipment. We had to look after the well-being of students in residences. There were multiple research projects that you simply cannot abandon in the middle, or you will lose very considerable amounts of work. You have research equipment that you can't just leave it or turn it off, even over winter breaks and so on. So we have that sort of experience of keeping those things going. But there was a lot of education to do, that we were very complex organisations and would need a really differentiated approach. It wasn't closed or open. It was always going to be a complex mixture of what could be done on campus only, and what could safely be done there, and what could and therefore should be done off campus. With a presumption we would move everything off where we could, but a lot of things could not be moved.
Thank you very much. And Dr. Duncan, I should have asked you as well, from your perspective, in terms of the understanding of the extent to which universities can close on the part of the Scottish Government. Did you have anything to add to what Professor Leidig has said?
It was a phrase people use, not just politicians, but the press would talk about the universities closed, and we would constantly have to say, well, it's not closed. And I think quite quickly the officials that we were working with, because it was a very close liaison with SG officials right throughout the pandemic, they very quickly understood that it wasn't closed. But the phrase kept coming up again and again, and it did sort of imply perhaps a lack of understanding of the complexity of the operations on campuses.
Thank you. Professor Macbeth, if you could come in, please.
Okay. So we advised students and then staff on the 16th and 17th of March, respectively, that we felt we were going to need to move to closure. That allowed us a small amount of time to allow students and staff to gather their materials, their equipment, but particularly students to gather safely their work, which would be portfolio based, so some of their objects, some of their portfolio, so that they could continue working at home, and also some of the materials that they would need. And that allowed us to support them in doing so. And then, as Dr. Leidig has laid out, we also then supported staff in terms of taking their own kit and equipment so that they could work from home. We then moved to what was a significant upskilling in terms of our digital infrastructure and purchase of kit and equipment to support not only our staff but also our students specifically. And a comprehensive piece of work was undertaken, not only just actually choosing the digital platform that would be best for an art school to use. So contrary to a lot of other institutions, we worked with Zoom because it allowed us as an art school to work in a much more collaborative way than Teams would have allowed us at the time. I think all of those technologies have obviously moved at pace since then. We had obviously students in our halls of residences. We had our IT team, a very core small IT team on campus, and then we had obviously security, janitorial and some domestic staff just keeping our hygiene factors going, but a very small team on campus, but moving very much to look to support student health and well-being, which was obviously a huge priority, support those in halls of residence in terms of the students there, but also international students that were there that were unable to go home, and to try and provide as much wraparound in terms of health and well-being in those settings for those individuals. So it was very much that launching of a digital learning environment, assessment environment, and then supporting everyone in their spaces and places, and teams coming together in unique ways initially to cross-institutional teams to support that effort, and that was then mirrored. I think certainly I was impressed when I arrived into Glasgow School of Art around the support provided by University of Scotland and the liaison with Scottish Government, and how that was happening, which I think was really supportive and attempted to acknowledge our difference as different institutions within a HE sector.
Thank you very much. If we could then perhaps move on to discuss the move to and the sort of implementation of an experience of a remote or online learning. And obviously online learning is something quite specific. I think Professor Leidecker, you've mentioned that you have that sort of offering anyway, but yes, remote / online learning and the experiences of those, including, for example, the levels of preparedness of the institutions, the practical challenges in moving to remote and online learning, specifically digital inclusion or digital poverty of both staff and students, if those were issues, impacts on staff and students in having to engage in this manner, student engagement, if there were any issues around that, any disproportionate impacts on particular cohorts of students, any issues with perceptions of online or remote learning being somehow inferior to face-to-face, if you want to mention any positive legacy impacts in relation to online learning, and any other relevant key issues. So could perhaps start this round with Professor Leidecker, followed by Dr. Duncan, and then Professor Macbeth.
So it was obviously a huge challenge to move so quickly and so unexpectedly, I guess, to online learning. There was a lot to learn, and we had to do a lot of upskilling of our staff. So we have a unit that led that, and we provided a lot of training and guidance. We had that experience of online learning already that was helpful for us, and I think we built on that. But we made some mistakes early on, I think, as a university, or probably as a sector, in terms of probably putting too much material online and not paying sufficient attention to creating the right social learning opportunities online. So we did a very significant piece of work a year later to evaluate our approach to online and blended learning, and through that we started that quite early in terms of having some surveys of our staff and students and some focus groups, so that we continually refined this throughout. So no doubt it was a bit clunky in the early days, and there was a lot of work to do, first of all, to ensure that staff and students had the right kind of equipment to be able to operate in this way. There were no doubt some disadvantages to certain groups at that time. There was digital poverty. The funding from the Scottish Funding Council was very helpful in supporting the issuing of equipment to students who needed it. So I think, nevertheless, there were some, definitely some groups of students, probably the more disadvantaged anyway, economically, socially, who probably struggled with the adaptation more because of perhaps not having a quiet space or their own personal space to study from, not having Wi-Fi, broadband at home, and so forth. So I think it was a huge learning curve, but one that certainly we, and I think the whole sector, embraced very quickly. I think one of the things is that we were all thrust into a particular thing at once, and I think people really responded positively to that challenge. And we found in our evaluation that on the whole, students were reasonably satisfied with the blended learning that they had received, or the online learning they had received in the very early days, but there was a desire for more social contact, and therefore the return to more in-person learning when that was possible. So I think that's how I would sum up that move. I mean, there's a lot you asked, and we may want to unpack more of that, but that's an initial response.
Just in terms of the perceptions, perhaps, of remote and online learning, you obviously said there was a desire to have more social interaction and a desire to get back when possible. What was the perception of the quality of online learning versus face-to-face?
So from our surveys of students, I think the perception was that on the whole it was very strong. There were things that we needed to change in the course of things. So there was a lot of discussion about whether asynchronous, where you record something and make it available, or synchronous, where you hold live teaching sessions, were more appropriate. That had advantages and disadvantages for different groups. I think we realised that a balance was really helpful, because that created the opportunity, particularly when you had synchronous, where you could have all of the class there, and they could start to get to know each other and could start to benefit from that social learning as a group. So I think it was a question of using the experience that we had within the organisation to put in a base level, and then to continually enhance that as technology improved, as people's familiarity with that improved. The ability to create, for example, breakout groups within larger groups was something that was not, people just didn't know how to do that initially, but gradually people acquired the skills to allow them to create a much richer learning environment. And I think that's one of the lasting legacies, I think, that are relatively positive, that we have moved to be able to be more experimental and more effective in that kind of blended learning, and we have retained some elements of that. And I do think that there was not a presumption in the public sphere in Scotland, in the media or anywhere else, that blended or online was somehow inferior to face-to-face. And I think that was a helpful general sense within Scotland, which wasn't always replicated in the rest of the UK, that it's perfectly feasible and possible to offer a really good quality level of education. Not for all disciplines and not in all circumstances, but for the broad group of students, that's certainly possible.
Thank you very much. If we could turn then to Dr. Duncan.
Yes, I mean, I think Professor Lydecker has covered it very well. I think universities are not always the most agile institutions in the world, but I think we surprised ourselves with our own agility at pivoting to a different mode of learning and teaching very quickly. Few people might have had experience using tools like Zoom before, but all of a sudden everybody was using it and learning on the job how to use it effectively. It was probably helped by the fact that people didn't have a lot of other things to do. Students, were bored because they were trapped in their own homes, only able to go out for one walk a day or whatever. So there was almost a willingness to engage. Those students who perhaps in the past unwilling to turn up for 9 o'clock lectures on a Monday morning were actually turning up online for classes. And again, as Professor Lydecker said, that mix of synchronous and asynchronous learning evolved very quickly in most disciplines. It was possible to engage in personal contact between teachers and tutors and students, and to give feedback in the way, informative feedback in the way that the students expect and need. And I think for some students, in a way, perversely, it was almost beneficial. Shyer students, perhaps unwilling to talk in classes of 10 or 20 or even larger, perhaps more willing to engage online in front of a screen that they might not in the classroom. But there were lots of issues and challenges along the way. It required a huge effort on the part of teachers, of lecturers, to adapt courses to the different mode, and quite quickly we got reports of exhaustion and fatigue amongst the teaching staff. And then, of course, there was the curtailment of practical work, which is, covers a whole swathe of disciplines, and I'm sure you hear more about that in a second. And then some of those basic problems that we're all familiar with, harder for people who are living in inadequate accommodation, perhaps with family members of different ages, problems with Wi-Fi, although they tended to be sorted quite quickly, and then issues with access to laptops and equipment. But again, that was resolved quite quickly, and with government support as well. So kind of a mixed picture, but people encountered problems they never even thought about before, and they found solutions to them.
And just in relation to digital inclusion, and what sort of percentage of students were impacted by that had to be addressed? So
I'm not sure what the percentage figure would be, but the truth is that the large majority of students already had access to laptops, so that the numbers that needed to be given equipment, I think, was quite small. But we set up systems to do that, to address that need pretty quickly, and we're able to address it.
Okay, thank you. Professor Macbeth.
Yes, so very similar to colleagues, but with obviously particular nuances. So we had a very low level of digital infrastructure when the pandemic hit, and in a sense we had to make what we felt was quite a strategic decision to invest significantly. We obviously had support from Scottish Funding Council with this, but we needed to access really bespoke high-end pieces of kit and equipment, laptops, desktops, for particular disciplinary areas, and so we realised that potentially that there would be a significant problem in accessing those if we were to bide our time and wait to see if the pandemic might subside quickly. So we made the decision to move quite boldly towards the purchase of equipment, just so that we could access it. And obviously we made a decision to invest as an institution, but also then we had the funding from Scottish Funding Council, which was also hugely welcome. So we did that, and then we had to make a whole raft of software that's very bespoke to art and design practice available to students. We also needed to think certain disciplines need certain kinds of capacity of software and equipment, and therefore for certain disciplines we needed to quite quickly triage those sorts of kit and equipment and that very particular software that might need to be used in a certain way. So all of that was provided, and in fact a legacy of the digital kind of upskilling was our ability to provide that software to alumni in their first year during the pandemic era. So I think that was a really strong move towards that. In terms of our champions within our academy and our technical support team, we did have some. So we had our digital natives that were very strong on developing learning in that space, and we also had experience of doing joint projects with international partners, so we were able to draw on our expertise within the institution. So we had to draw them out and ask them to lead us in a way that they might not have done before, and actually that was a really strong way of kind of bringing team cohesion together as well and sharing best practice. But of course that didn't all happen at once, that takes a little while to evolve. We were very conscious of digital poverty and digital inclusion, and a lot of that was not to do with providing the technical facilities, because we were providing those to students. It was the infrastructure within homes or within residences, or just the bandwidth. If you've got a lot of students using a lot of really high-end software, that takes up a lot of capacity. So we had to do lots of workarounds with that as well. And our IT team were really fantastic in terms of how they just really imagined and enabled us to do that. In terms of classes, as Professor Lydick said, we started to use the digital facilities like Zoom and our ways of connecting with each other in really experimental ways. So in in art school, you sometimes have group tutorials, group crits. You might have several members of staff in with a cohort of students, and quite quickly we were using the Zoom space to have breakout rooms, to have teams, and then even to the point of actually having online exhibitions or online critiques, which is where students would come in and put up their work. So all of that began to happen. Again, trying to think through asynchronous and synchronous learning. So some things were really important to do together. So you might have a workshop that would be led together, and you would have the materials in your home, because that's part of that community of making and designing. But then other things that were more skills-based needed to be filmed and provided so students could go back and re-look at those. So a lot of that sort of content really emerged during lockdown and kind of was being populated by all the schools, but also online resources as well, actually, just to kind of give people things to do, in actual fact. I think we worked very hard to work with our widening access students that we felt would be the most disadvantaged. And we had, once we were able to, created a hub within the arts school, which was our hub building where students could book in to get high-end cameras or pieces of equipment that would then work within their digital environment. And we had a click and collect system, which we've actually kept as well. And we also obviously had library access with that as well. So we were able to do that. As soon as we were able to do that, we provided a hub building, because some students were not in a position to necessarily create the sort of work they wanted to within the spaces that they were occupying at the time, and therefore we needed to provide those in one building that we could keep, very strictly observing all the COVID requirements once we were able to do that. So finally, just to say, I think the other thing that we all learned through this was the pace of learning online would need to be potentially different to in person. That need to really highlight the need for breaks, space to downtime, and the pace and intensity of learning. It was quite important to manage that for everybody's health and well-being, actually.
Thank you. Before we move on, just one quick question, Professor Macbeth, about you mentioned delivering digital resources to your students, quite specialist. Were there any issues in relation to, you said it took, I think, a while to roll this out. Were there any issues in relation to accessing that in terms of supply chain or other issues?
No, and I think that was because we moved very quickly in terms of realising we would need to invest. And actually for us as an institution, it was an investment in our future, so we could see that beyond the pandemic, that was the right thing to do, actually.
Okay, thank you. The next theme we have is subject-specific impacts, including, if we could have a discussion, for example, impacts on practical and vocational subjects, impacts on subjects requiring close contact with others, impacts on placements, and other relevant key issues. And I think perhaps we could start with you, Professor Macbeth, because obviously you have quite a practical element to what you deliver. And I don't know if you obviously have similar issues to the Royal Conservatoire, and if you're able to, I understand you do have discussions with them, if you're able to draw in any of their experiences as well.
Yes, so I'll start there if that's okay. The Royal Conservatoire and ourselves had very similar issues during the pandemic, as did art schools in the rest of the UK, and conservatoires also. So for conservatoires, obviously there were a whole range of issues for them, particularly for dance students, particularly their ballet dancers, where obviously they need access to sprung floors, they need space to move in, and in a sense they're not unlike a performance athlete in their requirement, and also the potential for them to be injured. So that was of considerable concern, and certainly quite significant lobbying in terms of government understanding that there was specific needs that were absolutely critical within that setting. And I think once we got into that level of conversations beyond what are we doing with our residencies, how are we managing the sort of day-to-day, very, very open to the fact that we had very particularly different circumstances within art school and conservatoire. So there was an issue there, but obviously for students who played instruments, particularly wind instruments, in terms of the breathing and the need for screening around those students and the social distancing that needed to go on. So all of that was worked through. In terms of art school, obviously you have students who might be welding sculptures or hoping to weld a sculpture for their final show and suddenly having to rethink that completely because didn't have access to any of those facilities, for instance, and therefore would have to start to think about how they might create that in a digital realm rather than a physical realm. Some students we would encourage to perhaps flex, so to think about materials in a different way. So our silversmithing and jewellery students who might be more used to using precious metals would potentially be using kelp, so actually harvesting their local environment but actually finishing and producing work of an exemplary level. And we actually have some of those items in our archives and collections now from that era where people thought about their materials very differently. So really trying to support students to produce in new and novel ways in relation to their circumstances. For art school, I would say, for conservatoire, really to continue to be able to practice and rehearse in new ways or ways that were enabling us to stay safe, really. Quite challenging, but we have networks across the rest of the UK with our partner institutions there, and certainly we were very much working, myself and the conservatoire, into those networks and sharing best practice and sharing core issues that were happening. So we were supported, we supported each other, but we were supported by our peers as well. And I think, I suppose the only issue with that, and we'll come on to that, I know in later on, was that because of the tier system in Scotland and actually in the rest of the UK, we were often, particularly in Glasgow, where we're both based, in a different tier to our other art schools. So there was a real concern once we came out of the lockdown into the tier system as to why we were operating in a slightly different way to perhaps some of the other art schools in Scotland, and of course that was to do with the tier system. Mm-hmm. Yeah.
Thank you very much. Perhaps we can turn to you next, Dr. Duncan, and then Ms.
Well,
Hyde.
a similar story, but across, I suppose, a wider range of disciplines, and quite a significant impact on the learning experience and the opportunities for students across those disciplines. So obviously, for PhD students, the inability to carry on a lot of research for dissertations, but for other students, the curtailment of lab work, or rather the switch of laboratory work to virtual labs, and the development of that whole concept moving on quite quickly. Field trips obviously stopped for teachers, social workers, lack of classroom interaction and placements for all students, a lack of opportunity to undertake internships and work experience, although there again you had the development of virtual internships coming along quite quickly, and a very different experience, I suppose, for medical students who are still quite often in hospitals, and for vet students as well, because obviously work with animals and patients and human patients continued, but limited access for the student population to take part in that. So a whole range of different impacts. I think the worst affected cohort were the dentists. Obviously, dentists, after they've done their clinical dental techniques exam, they have to be in close proximity to patients, and that work was very severely curtailed, and so we lost a cohort of dentists across the whole of Scotland. And I think that was probably the only discipline where that happened, where you basically lost a year of students, and for obvious reasons, I suppose, but quite a severe impact for them. In other areas, though, I think people did their best to find proxies, to find alternatives to face-to-face activities where they could. But it's probably fair to say, in across a wide range of subjects, it was a slightly diminished or curtailed experience.
Just in relation to the dentistry students,
Yes.
you said you lost a year of students. Did they repeat? Did they defer? What?
Yeah, I think all students had to basically delay a year in dentistry.
So they weren't lost altogether. They just
they graduated. We just lost one year's cohort. So there was one intake that didn't happen, if you like.
Right. Thank you very much. Professor Lydecker.
Yeah, not a huge amount to add to what Dr. Duncan has said, but perhaps focus on the health disciplines in particular. I know we've talked about the specifics of dentistry, but I think it was very challenging for those medical students as well, for a number of reasons. First of all, they were not able to have as wide a range of practical placements in different medical settings as they would normally have done, for example, out in GP practices. And they were often volunteering to work on the front line. That was quite challenging for them at the time. And they probably didn't have the range of opportunities in different clinical settings. And we also need to remember that many of the clinical, much of the teaching is done by clinical academics who were on the front line of coping with the health emergency. And so I think that did definitely have an impact on that group of students, and they often felt that they were actually at the front line. Many volunteered to work, and that was exceptionally positive, but they probably had more experience in some areas than they were anticipating and less in others, if that makes sense. Field work was a major thing that we spent a lot of time thinking about, not just virtual field work, but we also arranged field work that was much closer to home, where students could gather outside and perhaps do a little bit of observation locally, where they wouldn't be able to go and look at rocks up in the Highlands or environments in different parts of Scotland, say in the biological and geological sciences. But we did our best to provide those opportunities, and I think a huge amount of excellent work was done around practicals for sciences, for example. So, for example, you could film the experiment and then pass the data to the students. So it was as though they had done that, but they had the results, so they could then work on interpreting. And I think that was really, really good, and that allowed, I think, a greater inclusion than might have otherwise been possible because of the work that was done there. So, and I think some of those things are of lasting benefit to certain students who might, struggle with certain aspects of practical work or the accessibility of that.
Are there any particular groups of students you had in mind in relation to that might have benefited?
So, some neurodivergent students perhaps struggle with group settings and perhaps shy away from those, and find it difficult to be there for certain practical experiments and so forth, but they were able then to participate in a different way. That's just one example. There are multiple, one realised that the complexities of individual student circumstances were legion, actually, and it wasn't simply about people with mobility difficulties. It was a whole range of different disabilities, disadvantages that we learned to cater for, and actually some, felt that there have been really positive benefits to this process. The greater availability of digital resources that you could access in your own time suited certain people with, perhaps with caring responsibilities or and so forth.
Thank you. We've possibly touched on this already, but the next topic I had was impacts on research and laboratory-based work specifically, including, for example, impacts on studies involving human participants, distancing requirements to the extent to which those were necessary or unnecessary, and any other relevant key issues in relation to research and laboratory-based work specifically. Perhaps we could start with you, Professor Lydecker, and then go to Dr. Duncan.
So one of the real challenges for the university sector throughout the period that we're discussing was the requirements for physical distancing in laboratory settings. There was a requirement for 2-metre distancing in laboratory settings, which severely reduced the capacity of our research laboratories, down to something like 25 to 30% at 2-metre distancing. The sector lobbied very strongly on this with Scottish Government, including the University of Scotland publicly lobbying on this in 2021. The perception in the sector was that the restrictions were over-restrictive for laboratory settings in universities specifically. There were opportunities for less distancing in laboratories in the private sector and indeed elsewhere in the UK, and I think that had a very significant impact on our ability to operate those laboratories and to do as much science as we would otherwise have done. And despite this being something that we cared passionately about and wanted to see change, that did not change right through to I think March 22, when there was a broad lifting of restrictions. So I think that was probably one of the key impacts on research. Clearly, you mentioned research with human participants. We have a clinical trials unit. A number of clinical trials had to be abandoned because we either couldn't recruit patients, for example, or they had to be abandoned halfway through because it was impossible to continue to conduct those things with human participants. Psychology was another discipline that has a lot of, certainly in our science-based psychology, a lot of studies were not possible, and that was something we lobbied quite hard on. It was something that we tried to move forward. So there were a range of areas that were severely impacted. At the same time, it has to be said that, of course, the whole sector made a massive contribution to the research effort through the pandemic. We received there were specific funding streams for medical research, for COVID research. We were recipients of that, and we were very pleased, as the whole sector was, to play our part in trying to find solutions, and of course the famous cases of that throughout Britain and throughout the world in terms of that. So, but I think that laboratory settings was probably the absolutely critical difficulty we faced, and the difficulty was it seemed inexplicable because those spaces are very highly regulated. They have exceptionally strong health and safety protocols, very good ventilation, and so forth. And there was an opportunity, I think, to trust the professionals in the sector to operate those facilities in a way that would have been more productive for research in Scotland.
Thank you. Was there any particular reason given for maintaining a 2-metre distancing requirement in university laboratories versus a less requirement in other laboratories?
I was not personally involved in those discussions. I don't know, you may have been. No, I'm not aware of what the particular reasons given were.
I mean, it may be that the government was more receptive to approaches by commercial companies that were concerned they would go out of business if they couldn't continue to operate, rather than on research, which is non-commercial in nature. But I guess that's a question for the government to answer.
If I could add on this, that there's perhaps a perception that because you could do something, that was the appropriate decision. It was because we could operate remotely in terms of education delivery, therefore we should continue to do that. And of course in Scotland we did that much longer than was the case in the rest of the UK and in other places. So I think that's something that, reflecting on this, that I feel is one of the things that was perhaps a default position.
Mm-hmm. Before I turn to Dr. Duncan on this, obviously you talk about the restrictions, the 2-metre restrictions, and difficulties generally with conducting research. We're going to go on to talk about later impacts on staff and universities, but was there anything for researchers who are reliant on progressing their research in terms of career progression, were there any particular impacts on them and on any particular cohorts of researchers at your institution?
So I think PhD students were a particular group that were adversely impacted. They sort of sit between students and staff in a funny kind of way in that research environment, but they have a time-limited amount of funding in order to conduct their research and produce their dissertation. And for many, it was simply impossible. They had to reconceive their research because they were unable to do the practical work, either the field work or the scientific experimentation and so forth, or the work with human participants. So the sector, working with the funding councils and others and our own funds, worked really hard to try to prioritise those who were nearest the end of their studies, who needed extensions, and there was a lot of discussion around that and negotiation. And some funding was provided, but in some circumstances I think funding was not provided, and we needed to try and support them. So I think that group was particularly strongly affected. The other major impact, I think we'll probably come on to this, is that the emphasis on providing a really high quality student experience in terms of the education side definitely detracted from the research productivity at that time, as people took the need to focus on that absolute priority of ensuring that our students were able to progress and graduate. There were some significant impacts on staff in terms of their research progression, and that probably fell differentially amongst those who were caring at home for young children, particularly those who are homeschooling. We have to remember that despite our request, the Scottish Government did not classify university staff as key workers, and so they didn't have access to that opportunity for childcare and schooling and so forth, that I think probably did have an impact on research in universities.
Thank you. Dr. Duncan.
Yes, I mean, just to pick up on a few things that have already been covered. I mean, I think that probably was one of the criticisms the sector made of the regulatory regime, that it was just overly restrictive on research activities, and perhaps a lack of empathy or understanding of the importance of those activities. I mean, for a university like ours, across Scotland, there's an enormous amount of research activity going on in universities. For us, something like 250 million pounds worth of income every year comes from that. On average, academics spend a third to 40% of their time doing research activity. It's hugely important in terms of our reputation nationally and globally, but also more important in terms of our contribution to humanity. And large swathes of that activity just had to be curtailed for a significant period of time, and with a loss of research income as well for the university. It's worth saying that there was a kind of switch. Those who could, whether they were medics or engineers, quite a lot of them switched to doing COVID-related research, because the regime in terms of what you were allowed to do on that research was more liberal. And so both in terms of income, because funding bodies were switching money to support COVID-related activities, but also because you were allowed to do the research, there was a turn to that type of activity for a period of time, possibly to the detriment of other important areas of activity as a consequence of that. But it was a very difficult time for research activity, and it probably went on for too long in terms of the restrictions.
Thank you. Professor Macbeth, I don't want to leave you out, and I don't want to be presumptuous, but I'm assuming that research and lab-based impacts were not so much an issue for the Glasgow School of Art. But
they weren't such an issue because we don't have science in laboratories, but I just think it'd be helpful to say I think the lack of key worker status for researchers was a hugely affected staff in a really unhelpful way. And of course we mustn't forget that we were right in the lead up to the submission for the Research Excellence Framework, the REF, which is absolutely critical to all institutions in terms of their status within research and their ability to partner, but also their funding. That was paused actually, and we were given additional time, which we certainly took as a very small institution, and that was actually really critical at that point. But also, to echo what Dr. Duncan said, we have staff that are key parts of the Digital Care and Health Institute, but with the University of Strathclyde, and we had a number of staff who were working into critical areas within the COVID rollout in terms of innovation design and information design. So we had staff that contributed enormously as well, and again pivoted from what they were working on to the pandemic itself. So just really to reinforce and echo, but not to forget REF, because actually that's a critical moment for all HEIs.
Thank you very much. My Lord, we need to take a break. We're almost an hour in. It may be an opportune time to take that.
We'll take a break.
Right now.
I would just like to say that you'll probably not be surprised to know that many of the themes, they're context related, but many of the themes that we're hearing, we've heard for the past year now. But to show you that inquiries can sometimes take you by surprise, I have to say, Professor Macbeth, that the substitution of precious metals by kelp is a complete first off and surprised me pleasantly. Right, thank you. 11:15. Right, let's find Investor House when you're ready.
Thank you, my lord. The next theme I have on my list is assessments, attainments and classifications and new admissions, with potentially just touching on, for example, difficulties with online assessments, difficulties with practical assessments, perception of the integrity of the assessment process, no detriment policies, any positive impacts and any other relevant key issues. And perhaps we can start on this one with Professor Leidecker, and then Dr. Duncan, and then Professor Macbeth.
Yes, assessment was one of the key challenges through the pandemic. Clearly, we had to move away from in-person assessments, the traditional examination in an examination hall, and this had a lot of things need to be thought about through that process. So we had to develop guidance for our staff on the integrity of assessment and how we could effectively assess in different contexts. We worked with professional, statutory, regulatory bodies as well to ensure that assessments were in line with their expectations. And I think as well, though, it allowed an experimentation and a modernisation of assessment practices across the university and across the sector as we moved to a different type of assessment. We invested a lot in that. It was important to us to ensure the integrity of our assessment, and we also took a tremendous amount of time to ensure that students were treated fairly through the process. So universities are, of course, well familiar with catering for the individual circumstances of students who might be, for example, ill during a particular period of assessment or suffering a bereavement or whatever. So we have those sorts of things in place anyway. But of course, this was on a collective scale, whereby we tended to take the approach across the university sector of a no detriment policy. So, for example, if a student had, we generally classify degrees over the third and fourth year of their typical 4-year undergraduate degree in Scotland. So we would ensure that if they performed less well in their fourth year, they would not suffer a detriment if it was a clear drop in their performance compared with their third year. But we also had to make sure that students were meeting the learning outcomes. Ultimately, you can only award credit for learning achieved if students meet the learning outcomes. But we had to think quite hard about how we were assessing that to ensure that students were continuing to meet the learning outcomes. And that was a very intensive piece of work. There were lots of discussions across the sector about how to approach this, but ultimately each institution is responsible for its own academic standards, working with its external examiners, and we worked hard to ensure that A, students did not suffer a disadvantage, and B, standards were maintained throughout.
Thank you. I think we heard from the National Union of Students, and I think they indicated that there were a lot of really good and generous no detriment policies out there, but there was a concern that there was no uniformity across the university sector in relation to the no detriment policies that were implemented, and it made it difficult for them to give guarantees to students or reassurance to students. And I think they described a feeling of it was concerned about some universities were concerned about calling the policies no detriment policies out of a fear of being perceived to be soft touch, and they referred that there was a concern about it going to become a postcode lottery where, depending on which college or university you attended, you might or might not get a good no detriment policy. So could you perhaps just explain a bit? I think you've probably touched on it there about each university being responsible for their own accreditation, but why that might have been a perception of a postcode lottery across, and why it might have been different levels of no detriment policy implemented.
So I think that probably does refer to the fact that universities classify degrees in different ways and have that responsibility. So there is no national approach to degree classification. There are various different approaches in across the UK and the Scottish sector. I can appreciate that it might have been helpful to have had some guidance on this that might have been then approached by individual institutions. You couldn't say you must do X or Y, because that would not map on necessarily to the assessment practices and the classification practices of individual institutions. But it is fair to say that we worked hard to look and see what others were doing as well. So there was a little bit of, oh, they've done something quite interesting there, and our teams had to look across the sector to see what might be appropriate and proportionate. And we needed to have the confidence of students and our own academic staff in everything that we were doing as well. So I think some guidance might have been helpful in ensuring that students understood that there was a consistent approach. Just as, for example, University of Scotland developed a consistent core of care in student residences in September 2020, so that we students could then see that there would be a consistent approach to that, and I think that helped to settle things down in that space. Something similar in relation to no detriment might well have been helpful, but I don't believe there was specific guidance either in Scotland or UK on no detriment.
Thank you. Dr. Duncan, if we can perhaps come to you on this then.
Yeah, sure. Just to pick up on that theme on no detriment, it's worth saying, universities compete with each other all the time, but we're also incredibly collaborative. People are constantly swapping ideas, and in fact, the level of contact during the pandemic increased markedly, both with officials, but also within people doing particular jobs within universities. So that sharing of ideas and policy and developing policy collectively, I think, happened almost organically, faced with new demands and pressures. It's worth saying that the first lockdown came just weeks before the main exam diet for us and for most other higher education institutions. So we had to move very quickly to respond to how do we deal with the summative assessments and guarantee the integrity of degree programs. We took the decision, as I think a lot of universities did, not to have exams for first and second years. In other words, to allow progression into upper years of undergraduate degree programs without that summative assessment process, and to focus on people who are finishing their degrees, whether it's master's degrees or in the honours years of undergraduate degrees. And that allowed us to spend more time and effort making sure that the integrity of those assessments was maintained. It's worth also saying that there has been a process to move away from an over-focus on exam hall type assessments over a period of time. Universities for some time have been engaging in more varied, richer, perhaps more meaningful, arguably more meaningful forms of assessment, which don't just test retention of information, but test understanding and skills as well. And the COVID period probably speeded that up to some extent. It's probably worth acknowledging that there's still an active debate about the extent to which summative assessment should rely on exam hall type activity, particularly in the numerate disciplines where there's a concern that frankly you could cheat if you are working at home, and so I think where we've got to, particularly in the numerate disciplines, is a balance of assessment that guarantees the integrity, but also tests different aspects of a student's performance. And in fact, the COVID period to some extent has been helpful in moving on thinking in that regard. But I think it's just to repeat what Professor Lydecker said. I mean, the absolute focus was on maintaining the integrity of degree programs and making sure that standards were maintained across the board, and I think we did a really good job on that. It's worth also saying, worth adding, that we are, across many professional degrees, subject to external scrutiny by bodies, Law Society of Scotland, General Medical Council, a plethora of other bodies. We didn't get a lot of help or guidance from those bodies, I think, through the period. They themselves hadn't done much thinking, and would simply say, well, you need to make sure that students have attained the learning objectives that we've defined. But the thinking went on in universities. A lot of that thinking was shared across the sector, and I think we did a pretty good job.
And you've touched on the lack of guidance from accreditation bodies. Were there any other practical issues with, for example, for practical subjects with accreditation when you were dealing with external bodies?
So there did have the General Dental Council would be one where basically they simply said, well, you just can't graduate students because they just haven't had sufficient experience. Nobody wants to go to an inexperienced dentist, of course, so it kind of made sense, I think, to everybody to delay the cohort for that particular discipline. In other areas, over time, there was a growing level of engagement with those bodies to make sure that they were comfortable with the forms of assessment that were being applied. But in some instances, of course, you had to use proxies rather than practical tests.
So I'm thinking, for example, you mentioned you have a veterinary school as well. So were there any particular issues, for example, around veterinary students?
I think sometimes examinations would be done online rather than in the surgery or on the farm, every university farm. But once you get into outside disciplines, it was easier to maintain the social distancing that was required to meet the government's regulations.
Thank you. Professor Macbeth.
Yes, so really similar experiences from us, really obviously focusing on standards where we had professional accreditation with the Royal Institute of British Architects. There was a very clear network approach from the architecture schools in terms of how they would maintain standards and work through the requirements from REBA. So I think that worked quite successfully there. One of the things we really had to do and to focus students' mind on, particularly graduating students, was even though our graduate shows are now separated from the final examination of work, they're very much intrinsically linked in the students' minds, and so therefore we had to really strongly reiterate that they were two separate pieces of work, but also there was this absolute need for students to be able to showcase their work in a different way to the way they would normally have done through graduate shows, but actually to have graduate online shows. So that process of gathering a digital portfolio where we had to encourage students to possibly rethink what their outcomes had previously been going to be. When we closed in March, you're not suddenly going to be able to weld a very large-scale sculpture. You might have to do something else. To support the student in understanding that there would be no detriment around that that would all be taken into account, and their previous trajectory and the way they'd been working, had been documented and fully understood, and that we could get to an end point, but also then to reassure that we would show the work, and actually now to an international audience on these digital platforms, that then have a legacy beyond the normal time span of a graduate show. So although that was a very difficult moment for students, and we did actually follow up later on with a whole series of pop-up shows that probably we've only just concluded actually doing for students to give them that exposure in person to the art world, that I think is something that stayed with us. And so most institutions now do have graduate online platforms as well as their physical shows. So a whole range of approaches. We do a whole range of internal examination as well as external examination, which we invite colleagues from the rest of the sector to engage in. And so our methods, in a sense, were already worked through. They just had to happen in a different realm, which was digital rather than physical in the first instance.
Thank you very much. Then if we could perhaps move on to mental health, well-being and social impacts, and include discussion, for example, on impacts on mental health and well-being, any support offered, social impacts, disproportionate impacts on particular cohorts of students, or other relevant key issues. And I think in this context, if we can focus on mental health and well-being and social impacts on students rather than staff, because we'll come on to discuss impacts on staff separately. So perhaps we can start with Dr. Duncan this time, followed by Professor Macbeth and Professor Lydecker.
Thank you. I mean, this is a very broad topic. I mean, to start with social impacts, obviously, a lot of students are living away from home, and so when the pandemic started, when lockdown started, a lot of students couldn't go home, and so we felt as an institution we had a duty, obviously, to help to look after, in the general sense, students, particularly students living in our residences. I mean, there's one residence with 1,200 students, all first-year students in Maryhill in Glasgow, where at the peak we had something like 600 students were testing positive for COVID, which basically meant that every flat in that building, people couldn't go out. You know, they were having to stay in, and they had to be supplied with food. So the impact, that was probably the most severe example that we had as a university, but obviously you had people socially isolated, facing practical issues like access to food and so on, but also suffering the loneliness and isolation that could come from that, and being separated from their families, which is what was different from the rest of the population. And of course that continued throughout the successive lockdowns as well. I think it's probably fair to say that over time, more students over the years, certainly the years I've been in this job, more students have been coming forward with mental health conditions and with conditions like neurodivergence on the autism spectrum, ADHD and so on, of varying levels of severity. I think we have seen since 2020, you've got the numbers here, a 54% increase in registered students coming forward to register with our disability services, and 42% of them have mental health issues. And we see that number rising. I think overall we've got about 14% of our students now have registered with disability, and that's higher in other universities. I think at Edinburgh it's closer to 20%. So there was a trend that was happening, I think, before COVID. I think it's impressionistic, but you can sort of guess from the numbers that COVID has exacerbated that experience, but the trend is continuing post-COVID. So mental health issues is one thing, social issues is another, but the two obviously intersect. Mm-hmm. And we could probably talk for hours about it, but it was a very important aspect of the provision that we tried to offer students throughout the pandemic and beyond.
Thank you. Professor Macbeth.
Okay. I concur with Dr. Duncan on pretty much everything he's just said, apart from we didn't have major outbreaks in our halls of residence. I think partly because some of our students had managed to travel home prior to the main lockdown, but the students that were left were either students that didn't feel they were able to go home, or international students who were still with us. So at various points in the pandemic and at various moments we may have had more or less students, but we did manage to avoid major outbreaks, which I think was helpful. But essentially it was that loneliness, isolation, or potentially a student being in a group where actually perhaps relations had broken down for one reason or another, and that's quite hard to manage, although an awful lot of pastoral care went into those residences in terms of care packages and a whole range of wraparound interventions, essentially. But of course, the trend around mental health and well-being being a problem that was increasing within the sector and very noticeable, I think, to us all over the last 5 to 10 year period, meant that we were building our teams in that area. But essentially, actually, that there is such a need for the specialists in that field that actually it's quite hard to access them. So we had a small team because we're a small institution. We then really invested in a whole range of other sort of online platforms, triage options, and certainly in the Christmas period 2020, when we went into a second lockdown, we were very concerned about student situation at that point during that period, and put in a whole range of additional interventions and had a senior call system, which I think most institutions did, but really mindful also of the impact of our counselling staff at that point, and actually the enormous work they'd done and the terrific work they'd done, and that actually that whole triage of that space, we needed to ensure that they had some downtime as well. So we put in a whole range of measures actually that we kept now, because actually they ensure that somebody doesn't drop through any gaps in our systems, which is obviously absolutely essential. I think the issue really was around for students it wouldn't perhaps normally have been affected, the loneliness, isolation, but also the uncertainty of the situation with us moving in and out of tiers or in and out of lockdowns. And then so for anyone that's feeling vulnerable, that lack of certainty actually increases that. So I would say that would be something we really need to consider in a future pandemic.
Thank you very much. And Professor Lydecker.
Yeah, I think thinking about the 4 harms, the individual and societal well-being, this is absolutely squarely the issue here around student well-being, and there is no doubt, as colleagues have already mentioned, that there were very significant impacts on mental health across our student body, and I think that some of that has been lasting as well. It was good that we were able to get some additional support with providing counselling, for example, but there's no doubt that that level of counselling has needed to remain in place and indeed expand even in subsequent years post-pandemic. As we talked about a little bit earlier, that the range of different support needs was one of the defining things. So there were people who were isolated, as we've heard. There were people in private rental accommodation who were perhaps particularly isolated, away from home and away from even a student in the next door room or whatever. There were people in halls of residence who were subject probably to greater restrictions because there was testing regimes and the close proximity than perhaps other groups in society, even though infection levels were, I think, have been proved to be pretty similar across that age group. Subsequently, there were students who were simply didn't have a home to go to. That's, there are care experienced students, there are international students who had to remain in residence, and I think that was not always fully appreciated. So I think the key was having a dedicated team of people who cared passionately about trying to respond to the varying needs, whether in our own halls of residence, whether in the private rental sector, whether the students were at home and working remotely. And so we worked really hard on trying to understand what they were facing, and then to try to respond to it, and to try and create that social opportunity that they were so missing. But there's no doubt that had a significant and lasting impact on that cohort, those cohorts of students that went through university during that period.
Thank you. Professor Lydecker, if I could just ask you to elaborate on something you mentioned there. You mentioned the testing regimes, and that it subsequently turned out that the levels of infection amongst the students were reflective of the wider population of their age group. What sort of consequences were there of that? Or if you could elaborate a bit more about what the testing regimes were as well, please.
I think outbreaks in student halls of residence were probably more prominent, were more visible in the media and in the public perception, and that led perhaps to longer restrictions on on the way we were able to operate compared with other jurisdictions. So, for example, in the latter part of the pandemic, when restrictions were beginning to be lifted, we had considerable distancing requirements in place, for example, in our libraries and public spaces, that were not operating in nightclubs and pubs. And so you had a differential between what was possible for our students and what was possible for them in other contexts. And I think that was not necessarily helpful in allowing universities to create the kinds of social spaces, the kinds of interactions socially that for a group that was predominantly amongst that younger 18 to 22-year-old cohorts. That's not all of our student body, of course, but for those students, I think that they were probably subject to restrictions in university settings for longer than was necessary and longer than was operating in other contexts. And that was both confusing for them and also, I think, detrimental in allowing us to create the right social and learning conditions to improve their mental health.
Thank you very much. If we could then move on to discuss and again it's in quotation marks, reopening of university campuses and return to face-to-face learning, and include in the discussion, for example, multiple closures and reopenings and any issues around that, the level of understanding by the Scottish Government of the complex nature of universities, which we've already touched on in the context of closures, any issues in relation to differences in rules and guidance for Scotland compared to other parts of the UK and across different parts of Scotland. We've already touched on that, but if you could elaborate on that. And for universities compared with other sectors in society, any issues with the sort of one-size-fits-all approach, given the size and locations of different campuses, and the practical consequences of applying particular rules, for example, the 5% threshold or the 2-metre distancing requirement, which we've already touched on, and any particular challenges in getting staff and or students to return to campus, and any other relevant key issues. There's a lot in there, but please feel free to pick and choose which are the key ones. And if we could perhaps start with Professor Lydecker and then work our way back down the line with Professor Macbeth and Dr. Duncan.
So the framework that was introduced of levels, while on the face of it helpful in providing that framework, I think our perception was that it was almost one level too far in the direction of restriction throughout. So at various levels, level 4, level 3, the presumption was of very little in-person learning, except when it was absolutely essential, and that persisted for a very long time, and meant that we were operating under a much more restricted environment and planning framework than universities in other parts of the UK. So, for example, in May 2021 in England, universities were largely returning to in-person learning. That did not occur in Scotland until March 2022, when broadly the pandemic was deemed to be beyond level 0 in Scotland. And I think I think colleagues south of the border were astonished at the extent to which we were still operating as they had been operating during the early stages of the pandemic. So I think that had a very significant impact on higher education in Scotland in terms of our ability to shorten the severity of the impact and the kinds of impacts we've talked about in relation to mental health and so forth. That's probably the key area I would want to focus on. Perhaps I'll stop at that point just for now.
Okay, we can perhaps move down and come back.
Okay, so there were a number of things that really affected us in terms of that reopening, and I completely agree with everything Professor Lydecker has just said. Certainly that moment around Christmas 2020 to January 2021, the uncertainty and concern around whether students would be able to travel home and how that would manifest itself, and also then how they would come back, was an immense moment of concern, I think, for all of us, just in terms of, you know, what would be the implications if that weren't able to happen. So I think that was a hugely concerning moment, and particularly in terms of the different rules that were operating in the other 4 nations, never mind internationally, but that sense of if you were going to England or if you were going to Wales, etc., what that might mean for a student or even a member of staff, actually. So I think that's something that we really need to think of going forward. In terms of Scotland, in terms of art schools, doesn't really apply to the conservatoire in quite the same way. I don't think. We certainly had a lot of pushback between students who had friends, siblings at other art schools, so Edinburgh College of Art and Duncan and Jordaston, etc., because they were in different tiers a lot of the time to us in Glasgow, and we were in a much higher tier. So our students quite rightly probably thought, why are they being so punitive? Why are they being so strict with this? And of course it was our particular setting and circumstances, which of course we communicated and reiterated, but nevertheless it was very difficult for them to understand that. And of course, in terms of staff, that was confusing for them in terms of commuting staff as well, and whether they were able to commute to us to be on campus if that was necessary once we'd started to open up. We also had changes and differences in our operating model between our Highlands campus and our Glasgow campus for the majority of the pandemic. In terms of return to campus, certainly for ourselves, there was a moment where we were allowed to allow 5% back onto campus in sort of late 2021, and we were in a position where certainly conservatoires and art schools needed to lobby across from UK into Scottish Government to say, actually, we need all of our final years back in, or and students who are about to graduate, so that they can actually use the resources, because everybody in the rest of the UK is doing that now, and we're now at a huge disadvantage. We're putting our students at disadvantage. There's no data that's telling us that is putting anyone in a difficult situation. And actually, because of lobbying across from Universities UK groups into Universities Scotland and close work with the Minister at the time, we were able to make that case and to get back in at that point. But that fluctuation and that the optics of how we looked in Scotland in terms of why you might apply to us and come to us when they were trying to weigh up, should I go to an English art school rather than a Scottish art school, you know, in terms of our inability to allow full access or even any access into campus for most groups was really concerning and did affect us, and we're probably only just recovering from that now.
Thank you. Dr. Duncan.
So similar theme, really. We felt that at this stage, the regulation, the enforcement of the regulation was too slow in moving, and also there were frankly too many stages in it. It became quite confusing to remember the differences between the different stages, and I think some of the advice that we got nationally at that stage was a bit weak. You know, lots of confusion about whether you were supposed to cut the bottom off doors and all the rest of it. It just became a little bit ridiculous, and I think as a consequence of that, there was a certain loss of moral authority. So whereas people at the start of the COVID pandemic were prepared to accept any rules because they didn't know what was going to happen, by that stage they were beginning to become sceptical about the rules that were being applied, which were too slow in moving and too complicated and too confusing. And then the differences between the rules in Scotland and England, it was impossible really to understand why there had to be any differences. Even the slogan was different. In England they had, what was it, hands, face, space. In Scotland we had some longer slogan to go with. It just became a little bit confusing, and as I say, I think there was a bit of a loss of moral authority, particularly with that younger demographic. You know, people 18 to 24. Most of our students in that age group, the least at risk demographic. Most of them had COVID. They'd also been vaccinated. They knew that if they got COVID, the worst of their symptoms for the vast majority were like a common cold, and yet they were being restricted in their activities. And you know, some of the other aspects, you know, there was a joke going around that if you declared your library a pub, you would be able to reduce the social distancing that you were required to do, because in pubs you could stand closer together than you could in a library. And these sorts of things didn't seem to make sense to people, and I think there was a certain amount of dissonance in that period.
Thank you. In terms of, were there any challenges in getting staff and or students to return to campus at any point? And perhaps I can start with you, Dr. Duncan, and work our way back up the line.
I think for students, no. I think students were keen to come back, and they were keen to come back earlier than they were allowed to. And the kind of year difference between England and Scotland, I think, was particularly unfortunate. For staff, it varied. Some, people are different, and some staff had internalised a degree of anxiety that sometimes was expressed to us individually, sometimes through the trade unions. So for some people it was harder, and it still is for some people harder than others. But I think most staff were pretty keen to come back when they were allowed to, and saw it as a blessed relief from being trapped in their own homes.
Thank you.
I would add, I do think that for some staff, I mean, there were particularly vulnerable groups, of course, and we worked really hard to ensure that we understood who were in the most vulnerable category, and to ensure that they were not needing to come back. And we took a very patient and humane and sympathetic approach to those who did have that. And it wasn't simply staff as well. I do think there were many students who were quite reluctant to return. And I guess one of the lasting impacts is that, there's no doubt that probably that campuses are less busy in terms of both staff and students following that, and that has impact for our thinking about the future of our estate, what kinds of spaces to create in order to facilitate that social interaction, because there's no point coming into a campus where the buildings are empty. So I think while there's not necessarily reluctance, we did all put in place home working arrangements which have remained in place and have had a lasting impact. So reluctance, not always reluctance, but just change patterns of ways of working, that people had found other ways of working, and for some that has been a positive thing. They've been able to balance work with care and so on. We may come on to impacts on staff, but that's certainly so. It was not a straightforward return. Now is everyone's back, so to speak. It was quite nuanced, and a lot of individual circumstances were taken into account in relation to both staff and students.
Thank you. And Professor Macbeth, do you have anything to add to
I have nothing else to add,
challenges?
actually. I think it's been covered by colleagues.
Okay, thank you. Well, then perhaps we can turn to impacts on universities, university heads and staff, and include in the discussion, for example, financial impacts on universities, impacts on the ability to recruit foreign students, any ongoing impacts, and any other relevant key issues. And perhaps we can start with Professor McNabb, and then followed by Dr. Duncan and Professor Lydecker.
Okay. So in the first year of COVID, the financial impacts were very kind of apparent to us all, and I think we all modelled a whole range of scenarios in terms of what the financial impact would be, in terms of particularly loss of international students, but also home and rest of UK students as well. There was a financial impact for us, but it was at the lower end of our modelling. Potentially it could have been really problematic for us. We managed to mitigate that, I think, because there was a lot of leeway between if students might start online. If they were international students, we couldn't necessarily expect them to start in person, because we didn't know if in person was even going to happen. So there was a lot of unknowns, and I suppose in a sense we were able to make that work. So although financially there was an impact, it did affect us, and obviously that has an ongoing impact as we move forward. That I think we mitigated that as much as we could, and we did have support in doing that from the Funding Council and others, and we're very much listened to in terms of our concerns in that space. In terms of recruitment, I think it did obviously affect our international recruitment, but it affected also a whole range of home and rest of UK students in terms of the decision as to whether they would come to university in Scotland, or whether they'd perhaps rather go somewhere else in the UK where they could see slightly less stringent regulations. Of course, sometimes that works in reverse, because some people like the more regulated environment and are happier with that. But generally that did affect us in small ways, I think. In terms of heads and staff, I think obviously just the enormous amount of work that has to go into an emergency situation, and the new ways of working which stay with you and are positives, but you still have your core business to attend to, you still have your strategic plan to attend to. And I think there was certainly a point, sort of December 2020, January 2021, where it was quite clear to us all, I think, that business had to continue as usual, and we had to manage our pandemic strategy. So we'd moved to a COVID gold group. And in a sense, we needed to manage that as a key strand, but it had to be managed parallel to our core business and our other sort of obligations in terms of student experience, partnership, etc., etc. So I think we all sort of moved into that space whilst managing an awful lot of time and effort at very senior levels. You know, the amount of time principals met was, I think, monthly, if not bi-weekly at certain points. Normally that's a quarterly meeting for us, and certainly other colleagues in similar networks and working into government networks. So just the enormous effort for ourselves, but also our student representatives as well, our student associations and student unions, the amount of work that they did and within their networks, but with partnership with us, I think was extensive, and I think can't be underestimated. It does mean that we all have a blueprint for what we do if there's another pandemic or other really concerning situation that we need to kind of get ourselves around quickly. And I suppose you have to just take the enormous effort into a moment of, well, actually we know we can do that and we know how to do it, we have the tools to do it. So I think that's important for us to know.
Thank you. Dr. Duncan?
Not too much to add. I mean, it's worth saying that universities like ours, it's no secret that we are heavily dependent on income from the international student fee account, and that's important both in terms of income but also in terms of our global reputation. And at the early days of the pandemic, we were scenario planning for a complete loss of international students and catastrophic loss of income and global reach. In reality, that didn't happen. We managed to maintain our recruitment of international students and our attractiveness and the income associated with it through the pandemic, and that was it wasn't something we anticipated, but so it wasn't really as bad as we thought. The impact on research activity, as I think we said earlier, was probably quite severe, and a lot of research activity was disrupted, and we're still recovering from that now, I think. Otherwise, I think as I was saying earlier, we, in some extent, as in other sectors, we surprised ourselves at how agile we could be when faced with a major challenge like this. And I think because there was a will across the student population, across the staff population to respond positively and to adapt to the new situation, there was a kind of a Dunkirk spirit that affected the whole place, and I think positive outcomes. And we learnt new skills through it. I mean, the University of Glasgow ran one of the national PCR labs. We hired 800 staff within a few months and tested tens of millions of people right through the pandemic, and then let those staff go at the end of it. So these sorts of reactions, responses to to what was a national crisis, I think were genuinely positive. We also worked to avoid disadvantage. There's a risk that people's promotion prospects and so on would be impeded by not being able to engage in things like research activities. And there was a lot of effort went on with the trade unions quite often to make sure that we were being fair to all staff groups.
Thank you. Just in relation to, you mentioned then, obviously no secret that the universities are heavily dependent on funding from international students or income from international students. One of the concerns raised by the National Union of Students when they gave evidence last week was specifically in relation to international students signing up for courses, specifically in the 2020-2021 year, and not getting the experience that they signed up for by having to go into lockdown. And do you have any comments on that? And I think Professor Macbeth has suggested that Glasgow School of Art allowed international students to start online before coming in. What was the position in Glasgow?
It was very similar. I mean, obviously, everybody's experience was affected by COVID and by a switch to largely online learning, and that probably particularly affected international students. UK universities are incredibly attractive for international students. We attract, we compete with the best in the world in that sphere, and Glasgow and other universities here represented, included in that. But we maintained that attractiveness, I think, through the COVID period, and we did our best to make sure that the experience was a meaningful one for all students, whether international or home students.
Thank you. And Professor Leidecker.
Yeah, just to add to that, I don't think there's evidence, for example, from a national student survey that's conducted across all universities of a fall in satisfaction through the pandemic. I think colleagues have covered off the financial impacts. I don't think they didn't turn out to be what we anticipated. I'd like to focus more on the well-being impacts on staff. I think there's no doubt that the workload pressures were exceptionally intense throughout the pandemic, but particularly in the early part. We conducted a survey, a COVID survey in June 2020, and the overriding message was around workload pressures, and that was really across the board. It was, we've heard about the pressures on our academic staff to deliver education in a new way while trying to sometimes do research at the same time. But there were also our technical professional support staff, the ones who were on campus, who we worked really hard to ensure that they felt that we really valued them in the communications that we put out. I think the key thing was to create a sense of a single community working together across the entirety of staff and students. We took a number of measures to address the workload challenges. We set up a group with our campus trade unions to look at how we might address workload. And I think that stood us in good stead. We took a number of key decisions that have been long-lasting about the organisation of meetings, the timing of meetings, the length of meetings, the avoidance of email out of hours and at weekends, the necessity of people taking their annual leave and so on, to try to address those ongoing workload pressures. Those workload pressures were repeated in the 2020 end-of-year survey and in our survey in 2022. There's no doubt that the pandemic put an enormous strain on people because they wanted to do the right thing for the staff that they were working with and the students that we were working with. But those are, I think, lasting issues, and there's no doubt that that there is some talk of burnout amongst some staff. Because of the work that was put in throughout that period. People in the NHS, our clinical staff, were working incredibly hard to maintain the care in those clinical settings while also trying to deliver education in teaching our medical students. Those are just some of the elements of it, but I think that we need to put on record that was a really key concern, and the partnership working with trade unions was really strong in our institution, I believe, across institutions, and that stood us in good stead in trying to work through those exceptionally challenging years for all of us.
Thank you. I'm going to come on just under this heading to ask you all about key worker status, which we touched on in the context of impacts in relation to research. So I'll come on to ask you about it more generally across. But Professor Leidecker, before we move off, Professor Duncan mentioned working to ensure staff weren't adversely affected in terms of career progression, I think. In Aberdeen University, you mentioned when we were discussing the impacts on research, PhD students in particular, and then you touched on those with caring responsibilities, staff with caring responsibilities. Which staff were those that might have had higher caring responsibilities?
So in our survey in 2020, 44% of respondents said that they had caring responsibilities. This is across all staff, and 47% reported that this included homeschooling responsibilities. These were widespread experiences by our staff, and that's why we had to make adaptations, for example, in our promotions system to allow people to indicate where there might be mitigations in relation, for example, to the volume of research outputs or amount of activity that they might have been able to do. We also tried to prioritise those who'd been most impacted for things like research leave when that was possible to take, when the pressures were off and teams were able to free up staff. But it was really all hands to the pump for a while. But that had a disproportionate impact on those with caring responsibilities, particularly in relation to homeschooling, which particularly of a younger age cohort. I think it really depended on the age of one's children as to how intensive that period was. But that was really, and obviously for single parents, it's a much more complicated arrangement to try and balance those responsibilities with the education of the next generation with carrying out one's role at the university.
And was there any, was it equally split between men and women, or was there disproportionate impact on?
I think probably more women had more responsibility for more of the care, but we realised early on that was one shouldn't jump to that conclusion, and there were certainly households where that was not the case. For example, you might have had a female member of the household might be a key worker going out to work in a hospital or whatever, and so the responsibilities fell on perhaps the male in the household, in a two-person household with young children. So again, best not to jump to conclusions about which particular demographics were impacted. We did some work about early on in the pandemic, looking at our research grant applicants and so on. We found that actually early on, at least, there were not particular gender impacts that we could see in the work that we're doing. We tried to monitor that very carefully, so I wouldn't draw general conclusions.
Thank you. And then perhaps we can just then touch on key worker status and whether that was, you mentioned that research staff weren't granted key worker status. What was the issue in relation to other just general teaching staff and other staff, non-academic staff? And if I could perhaps start with Professor Lydek and work back down the line.
Yeah, I think it didn't really matter what role you're in. This was a potential impact. Both, we talked about research before, but there were those who were heavily involved in the education side who were obviously having to deliver probably more classes in smaller groups when we were able to return to in-person teaching in small groups and so forth, but also those who had to come onto campus to do their roles, the ones who were providing the food parcels to students, who were doing the laundry, the ones who were maintaining the IT systems, the ones who were doing all of that work. So I don't think it was a particular part of our workforce. I think it was, I think as I've said, there was a general impact, and we possibly the ones who had to be on campus were the ones who had the most challenge in a way, because if they weren't able to find, if they didn't have key worker status, then they clearly had significant difficulties in being able to come onto campus and find other arrangements for the caring responsibilities at home and the homeschooling responsibilities.
Thank you. Professor Macbeth.
Yes, so essentially pretty much all staff, whether they were coming in and key workers or whether they were not deemed to be key workers but having to not only homeschool but potentially be carers as well for others who wouldn't necessarily be able to go into a health or medical setting that perhaps previously would have been able to do. In a sense, that affected everyone, but they did have to continue working, and I think the thoughts about how key worker status is allocated, I think, is absolutely key going forward, because the pressures on everybody really in that situation, and I agree with Professor Lydecker, I don't think it kind of had a particular gender effect. I think it affected all sorts of people and all sorts of settings in a variety of ways. So I do think the notion of what a key worker is, and particularly if there's caring or childcare responsibilities involved, is absolutely essential going forward. We managed it. We tried to triage workload. You know, we listened to folk. We had workarounds, but there was an awful lot of new approaches and new ways of working that had to happen. So initially devising new ways of working, and therefore the workload in terms of perhaps delivering a class but in a very different way online meant that there was an enormous amount of additional pressure, but also additional expectation from the receivers of that information, whether that be work colleagues or students. And and then obviously going back into settings, or partially going back into settings with really quite small student groups. We already deliver in pretty small student groups, but when you put social distancing, the sort of multiplication of that, but obviously the expectation from your student is still the same. So all of those things really need to be thought through and triaged if this were to happen again.
Thank you. And Dr. Duncan,
I don't have much to add. I mean, on our campuses, there are about 70 people that were deemed to be, I think, essential workers that had to come in. A certain amount of tension at times between staff, whose jobs required them always to be on campus, and others who have greater flexibility. But that's true all the time anyway in universities. So I think it's something we lived with.
Thank you. Then finally, if I can invite you to indicate any potential lessons that can be learned from the experience of the pandemic, and just in order to either mitigate impacts that are ongoing and or to ensure that those impacts aren't felt as severely in any future pandemic or other disaster. If I could start with Dr. Duncan and we can work.
Well, just four quick points from me. One is I remember before COVID came along, being advised by our health and safety people that if there is ever a pandemic, you'll be told what to do. Public health authorities will come in, your authority will be taken away, and you will be given clear instruction. Well, that just wasn't the case. There wasn't draft guidance in place, I think, for any sort of pandemic as far as we could see. And I think the first lesson has to be that the country has to prepare, the authorities have to prepare with some sort of draft guidance for different scenarios well in advance next time. Secondly, if we could avoid local variation and see more joined up thinking across the nations of the UK, that would be helpful, because I think the variation that we saw was unnecessary and extremely unhelpful for us as we went about our business. The third is that narrative that crept into public discourse during the pandemic around balance of risk is something that we need to think about from the start, rather than just say, well, we'll lock everybody down because that's the right thing to do to avoid deaths. Well, not necessarily. You're locking people up who are suffering a common cold and actually having a severely adverse impact potentially on their mental health. These sorts of issues, I think, need to be kept in balance in the pre-thinking as well as during once the pandemic starts. And then the last thing, I think, which is probably a running conversation that ought to go on, is around making better use of the expertise that we've got in our higher education institutions. I mean, obviously, a lot of that expertise was used in all sorts of different ways, but we could help prepare. We could create a resilience unit, for example, that would support Scottish Government in its planning and its preparation. We could have a database of relevant expertise across HEIs, so it's not just a case of picking out a few individuals to help. There are probably lots of other things that we could do to help in this space, and I think we'd be willing to talk with officials and take that discussion forward.
Thank you very much. Professor Macbeth.
Yes, just to sort of build on that, I absolutely agree. I think a resilience unit, so the conversations that we got to in the end were happening already and just happened because that would be good for all of us. But also within that, an innovation unit. So one of the really strong legacies that's come out of this is our approach to blended learning, hybrid learning, that many of us have kept in order to do our business in a better way and to augment what we already have. In a sense, that could be built very strongly into that and can be part of what is seen as a legacy of this. I absolutely concur that which is why I'm going to reinforce it, that the consideration about how we work across the four nations, I think, is vital if going forward, and consistency of messaging to avoid unnecessary concern, poor health, mental health and well-being, but also just that agency for the common good, really, I would say. And I think, I think that's it really from me.
Thank you very much. And finally, Professor Lydecker.
So I think, to return to the four harms, I think with hindsight, the third harm around societal individual well-being was probably underestimated, and I think ensuring that that is fully understood, that the impact on well-being, mental health, was profound and long-lasting, and should not be underestimated, and should form a key part of future thinking in relation to pandemics. I think government should not really impose greater restrictions on students than on the wider population unless there's a clear public necessity for this. And I think we felt that there were probably at one point too many different regulations and bits and pieces and changes and chopping that impose an enormous amount of workload to work out, what kind of ventilation, what kind of distancing, what kind of screens, and so on. That if a broader framework were put in place, and then we were to be trusted to operate professionally within that, given the complexity of our organisations. And I think the points we made about distancing in laboratory settings would be a classic example of that. That was just something that if it had been left to us within a framework of working safely in laboratory settings, we would have been able to operate perfectly safely, and it would have been to the benefit. I think finally, I think we felt that it would have been helpful if we had had greater access to testing and vaccination, particularly testing. We had a joint centre in the end in Aberdeen, which was really helpful. It was a community testing centre as well as a university test centre, but we weren't able to get the ability to test students there. The contracts were quite complicated, and we weren't allowed to test in a way that would obviously have been of benefit. That would have allowed us to test students before departing for that winter break, which would have been really, really useful. So we had to put in place all kinds of measures to allow them to be safe in departing. So I think that was probably another key point that would be worth thinking about in future around access to testing.
Thank you very much. My Lord, I've no further questions unless your Lordship has any.
No, I've got no questions, but I'd like to thank you all for a very stimulating discussion, very clearly and logically set out. I suppose I shouldn't be surprised. That's what universities are for, stimulating our minds and doing it logically. In fact, listening to you took me back. It's a very long time since I was at university, but it did take me back to my experience there. Thank you all very much indeed. And that's an end to this morning's hearings. It's this afternoon just. We will be back at 1:30. Thank you all very much.
All rise.